Bacterial vaginosis, or more commonly known as BV. While it's a common condition, it's not one that many people feel comfortable talking about. But we're here to break the stigma and shed some light on this important topic. If you're a woman who has suffered from this common vaginal infection, you're not alone. BV affects millions of women worldwide, and it can be frustrating and uncomfortable to deal with. However, the good news is that BV is treatable and preventable. So in this episode, let's dive in and learn more about this common condition and educate ourselves. Let's first talk about what BV is and how it happens. BV is a type of vaginal infection that occurs when there is an imbalance of bacteria in the vagina. Normally, the vagina contains both good and bad bacteria. However, when the bad bacteria overgrows, it can lead to an infection. The exact cause of bacterial vaginosis is unknown, but there are several factors that can increase your risk of developing it, including having multiple sexual partners, using perfumed soaps or vaginal sprays, smoking, if you have an IUD, also called intrauterine device fitted, and douching, which is cleaning the inside of the vagina with water or other mixture of fluids. BV is an infection that has been recognized for many years. The condition was first described in medical literature in the early 1950s, and since then, research has continued to improve our understanding of the infection. BV is estimated to affect millions of women worldwide, with studies suggesting that up to 30% of women in the United States have the condition at any given time. However, the prevalence of BV varies globally, with higher rates reported in some regions such as sub-Saharan Africa. While BV can affect women of any age, it's more common in women of reproductive age and is often associated with sexual activity. Despite its prevalence, many women may not seek treatment due to lack of knowledge or stigma surrounding vaginal infections. Therefore, it's essential to continue educating women about BV and the importance of seeking medical care when symptoms arise. Speaking of symptoms, let's look at what they are. The most common symptom is an unusual vaginal discharge, which may change color, such as becoming grayish-white and thin and watery. It can also have a strong fishy odor, particularly after a sexual act. Some women may also experience itching and burning in the vaginal area, as well as pain during urination or sex. If you think you may have BV, it's important to see a healthcare provider. They can diagnose the infection by performing a pelvic exam and taking a sample of the vaginal discharge. Now, let's talk about the treatment. Treatment for BV usually involves antibiotics, which can be taken orally or applied as a cream or gel directly to the vagina. It's important to take all the medication as prescribed, even if your symptoms go away before the medication is finished. It's common for BV to come back, usually within a few months. If it does come back, you'll usually be given more antibiotics to treat it. If you keep getting it, that is, getting more than 4 episodes a year, you may be given an antibiotic gel that you put in your vagina. You may need to use this for a few months to help stop BV coming back. Talk to your doctor if this happens to you. If you develop BV in pregnancy, there is a small chance of complications such as premature birth or a miscarriage. But BV causes no problem in majority of the pregnancies. So speak to your doctor if you're pregnant and your vaginal discharge changes. Now, let's talk about prevention. To prevent BV, there are several steps you can take. First, avoid douching. as this can disrupt the balance of bacteria in the vagina. It's also important to practice safe sex by using condoms and to limit the number of sexual partners. Avoid smoking and do not use perfumed soaps, bubble baths, shampoo, or shower gel in the bath. Finally, try to maintain a good vaginal hygiene by washing your genital area with warm water and mild soap.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.